I'm Kenneth Hopland here at Medical Care, and today I want to talk about something that's near and dear to me, which is colon cancer. I think that all of us have experienced colon cancer through either a friend or family member or someone we know. And the reason I want to bring this up is I really want to talk about colon cancer screening. Obviously, I think everyone knows colon cancer caught in its earlier stages has a very different outcome than colon cancer caught in its late stages. And quite literally, that can be the difference between life and death. The question I have is, how do I get people to get the screening for colon cancer? And often, why might they decide to do that? And what ways can we do this screening? Is this something for me, or is this something that I don't want to do at all? I'm a huge supporter of basically information for people to make up their own mind. And what I'm hopeful today is that as I present this information to you, I'll give you information that sways you to do some colon cancer screening if that's appropriate for you. The first discussion is, okay, colon cancer, why do I care? And the answer is colon cancer is the number 3 cancer diagnosed in the United States, excluding skin cancers. So little skin cancer is excluded. Colon cancer is number 3. It is also the number 3 killer. So this is not a disease that's rare, hard to find. We're talking about something that is front and center. In the United States this year, 2021, it is projected we will have 53,000 people die of colon cancer. Now, to put that into perspective, that's 1/10 the amount of this pandemic, okay? Only we do that every year. So that means over 10 years, we lose as many people with colon cancer as we have lost to this pandemic. That's a big deal. So the question is, can we do anything about it? Just like we're doing the vaccine for COVID-19 to try to save lives, can we get people to get screened for colon cancer to save lives? And the answer is, I think that we can. I know that it works, and I want to present some information to you that shows that. We've been screening for colon cancer since about the 1980s, and during that time, colon cancer has been on the decline, both in diagnosis in those people who are older, but also in deaths, primarily due to screening. This is a success of medicine. We actually are bending the curve on this. We are changing the likelihood of people dying of colon cancer. But even with that being said, currently, in your lifetime, the average person has the possibility of getting colon cancer in about 1 in 25 people. So if you know 25 people, there's odds are you know one of them that's going to get cancer. So getting screened for colon cancer reduces that risk. There are 3 primary ways that we screen for colon cancer. Why might I choose one over the other? Okay, why would I pick a different type of screening process? Why don't they have just one? If one is the best, why do they have several? Those 3 ways of screening is with what they call fecal imicult test, or what people call hemocult testing, which looks for blood in the stool. The other is a rather new test called a Cologuard, which includes hemocult testing plus a DNA test looking for cells that might be precancerous. And the last is colonoscopy. All 3 of these have their each individual parts, and why you might choose one over the other. They are all acceptable forms of screening and recommended by the U.S. Preventative Task Force for screening for colon cancer. Let me start with the simplest. The simplest is a hemocult, or what they call a FIT test. This is a test where we screen your stool or your poop for blood. A lot of colon cancers cause loss of blood through the gastrointestinal tract. And if we find blood in your stool, that increases the likelihood that you may very well have a colon cancer. So when we do an annual hemocult test, we are looking to see if there's any blood. If there's no blood, it doesn't mean you don't have cancer, but it means your risk is significantly lower than it would be than if you did. The other test is a very specific test called a Cologuard. That test includes looking for blood in your stool, but it also has a really modern test looking for DNA from cells from inside your colon that might have changes that are known to be associated with colon cancer. This actually is just a little more sensitive for colon cancer. It is a little more likely to find it early than you would with a hemocult test where you're waiting for a colon lesion to bleed. This would catch it possibly before it is bleeding. Even though the others are acceptable, the last form of screening is kind of the big mama jama, and that is colonoscopy. The reason I would call it kind of the gold standard is if either one of the previous 2 tests are positive in their screening suggesting you might have colon cancer, they're going to fall back on a colonoscopy as the definitive test to see if you have that. You can start with a colonoscopy without going through the other 2. The reason, of course, that not everybody chooses to do this is that a colonoscopy, it's an invasive procedure. It requires anesthesia, it requires a bowel prep where you basically drink enough liquid to clear your colon of all fecal material. And that's not as easy to do. So a lot of people like to choose the easier, but the colonoscopy is really the end-all of those tests. It also shows a greater mortality-specific reduction for colon cancer. So a colonoscopy shows about a 65% reduction in colorectal cancer mortality, whereas an annual hemocolor fit test shows about a 30% reduction in specific colon cancer mortality. The Cologuard is a new enough test that I don't believe there is any data to show exactly where that lies, but my bet is because it's a little more sensitive than the FIT test, it probably lies somewhere in between the two. Another advantage of colonoscopy over the other forms of screening is that a colonoscopy not only can be diagnostic, but it can actually be preventative. If the person doing the colonoscopy finds a polyp during the procedure, they can actually remove that polyp. And if that polyp was going to become cancer, it's not going to anymore. And so not only does a colonoscopy provide a diagnostic tool to catch cancer early, in that situation it may actually keep that person from ever forming a cancer they were on track to get. So the next question people ask is, okay, who should get this? Am I the kind of guy or am I the kind of gal who needs to be screened for colon cancer? And really the main answer is yes, if. And then the if is, it is recommended that by the U.S. Preventative Task Force that everybody gets screened for colon cancer between the ages of 50 and 75. The American Cancer Society has actually suggested that we move that age range down to 45. I think there's a lot of debate amongst physicians as to whether or not to start at 45 or start at 50. They're both reasonable, and if that is something of debate for you, I think I'd recommend talking with your doctor about that. They'll probably have an opinion about why you might choose to start early or choose not to. The other thing that might persuade you to get an early colonoscopy or early colon cancer screening is a family history. It is recommended that if one of your first-degree family members, which means brothers, sisters, mother, father, is diagnosed with colon cancer before the age of 60, they recommend you start 10 years earlier than most people. So start at age 40 rather than at age 50, because they know that cancer probably existed for quite a while before they got diagnosed. And if you catch it early, once again, that makes a difference. That's how we decrease mortality rates. The next question is, there was a cap on there, and it said 75. That does not mean that no one over the age of 75 needs to be screened for colon cancer. If you have symptoms that are consistent with colon cancer, by all means, that is something we need to look into. But the reason they don't recommend the elderly population get generally screened for colon cancer is not that they aren't at risk for getting it. There is some question as to whether or not early detection at that age actually will make them live longer statistically. And so it's an individualized discussion as to at what age we stop doing colonoscopies. The general recommendation is age 75. And I think that a lot of doctors, depending on what someone's state of health is, might change that a little lower or might raise that a little bit if someone's in great health. So that is who needs it, which is everybody in those age ranges or anybody who has that family history. They need to get screened for colon cancer. The next question I get asked is, how often do I need to get screened for colon cancer? And the answer to that revolves around which test you get. The FIT or Hemocult test is recommended to do every single year in order to get that mortality reduction that I explained earlier. That is an annual test. Now the good news is it's not an invasive test. Essentially it's a matter of just doing a stool sample and you send it off to be tested once a year. Pretty simple. The Cologuard is a more specific test, and so it is recommended to be done every 3 years because of the sensitivity that's picked up with the DNA test that it does. The last is the colonoscopy. The general recommendation is if you have a normal colonoscopy, it doesn't need to be done for another decade. So we're only talking about once every 10 years. But if someone has polyps that they find, that can be reduced to 5 to 10 years, depending on how many and the size of the polyps that people find. Hopefully I've answered a lot of questions. I think that this is an important topic. I highly recommend that you think about it. If your doctor hasn't asked you, ask them. Be proactive. Take charge of your health and do what you can do to protect yourself. We don't want anybody dying from colon cancer in this practice, and we certainly think for the whole world that everyone agrees. The question is, can we actually get that done? So, in short, everybody needs colon cancer screening in the age ranges that are recommended. There's many different options for you, some which are invasive, some which are not, depending on your degree of comfort level. might choose how you decide to do this. But I hope that you'll consider getting that done, because by golly, if we get this done with a lot of people, we'll save a lot of lives. This is Kenneth Hopland with Medical Care, wishing you a great day and the best of health.